When a patient has altered consciousness, one of the most important bedside assessments is the Glasgow Coma Scale, or GCS. It provides a way to assess three responses: eye-opening, verbal response, and motor response. First, assess eye-opening. If the patient's eyes are open spontaneously, the score is E4. If the patient opens their eyes when spoken to or when their name is called, the score is E3. If there is no response to voice, but the patient opens their eyes to an appropriate painful stimulus, the score is E2. If there is no eye opening, the score is E1. Next, assess verbal response. What is your name? Where are you? What happened? Appropriate and oriented conversation gives V5. The patient can communicate but is confused, V4. Patient recognizable words, but they are inappropriate or unrelated to the conversation. This is V3. Moaning, groaning, or sounds without understandable words. This is V2. No verbal response. This is V1. If the patient is intubated, verbal response cannot be assessed normally. So V is NT, meaning no testable. Motor response carries the highest weight. Patient follows the command. This is M6. The patient attempts to identify or remove the stimulus. This is M5. Patient withdraws the limb from a painful stimulus with normal flexion is M4. Show abnormal flexor posturing to stimulate. This is M3. Show extensor posturing to pain is M2. No any motor response. This is M1. Always document the individual components as well as the total score. Don't simply write GCS and number equals 1315. This makes clinical communication much clearer. GCS score is divided into mild, moderate, and severe. To evaluate a specific situation, EVM and intubated or sedated must be considered. The trend is extremely important. A fall in GCS may indicate neurological deterioration and requires prompt clinical assessment. Always compare the current GCS with the patient's previous score. Document the individual components, total score, and time of assessment. This allows the entire clinical team to recognize changes quickly.